I saw 3 infants with ESBL UTIs in the past 2 weeks alone in my hospital. What does this mean? I'm Dr. Nikki, I'm a pediatric hospitalist, and today we're going to talk about superbugs. ESBL stands for extended spectrum beta-lactamase. It's an enzyme that certain strains of bacteria produce that allows them to resist nearly all antibiotics that we would typically use for these infections. In many of these cases of ESBL producing bacterial infections, they are only susceptible to a certain class of IV antibiotics called carbapenems. That means that this particular strain of bacteria would not be killed by any oral antibiotics and even many of the IV antibiotics that we have. So these infants or children or adults who happen to have these infections with the ESBL producing bacteria end up staying in the hospital sometimes for 7, 10, 14 days depending on what kind of infection it is, requiring this very particular IV antibiotic. So what does this mean looking at the big picture? It means that we are seeing an increase in these superbugs that are able to resist the majority of antibiotics that we have available. And one day they may find a way to resist the only antibiotic that they are currently susceptible to. So how do we stop this? Well, these superbugs are created because of the overuse of antibiotics. And everybody, patients, families, physicians, and all other healthcare providers play a role in the responsible use of antibiotics. If we are prescribing or taking antibiotics for every viral upper respiratory infection or viral ear infection, this is how these superbugs begin to develop. So patients, if your healthcare provider is prescribing an antibiotic for you or your child, make sure you ask them for their reasoning. Antibiotics are life-saving and should be used in the appropriate situation if there is a proven bacterial infection or a suspected bacterial infection, and your healthcare provider should be able to give you good reasoning why they are choosing to do so. If you hear a reasoning like, I'm giving the antibiotic just to get ahead of this, or just in case something develops down the line, that is not a good enough reason. Something along the lines of, you've been coughing for 3 weeks now, and now you've developed a low-grade fever. I'm concerned that you have walking pneumonia, and therefore I am prescribing this antibiotic, is an appropriate response, even though you may not have any particular workup. You don't necessarily need labs or an x-ray to diagnose a bacterial infection, but you should have appropriate reasoning. On the flip side, parents or patients, if your provider is telling you that they are not going to be prescribing antibiotics because they believe that this is a viral illness, they should also give you good enough reasoning and explain and address your concerns. With that, they should also be giving you anticipatory guidance. This could look something like, we're not giving antibiotics today because your child likely has a viral upper respiratory infection. Here are the things that you should look out for if the cough lasts a certain amount of days, if the fever lasts a certain amount of days. They should be giving you a contingency plan so that you know what to look for to know if the child should be reevaluated, because there could be a potential for a superimposed bacterial infection to develop later on. But that does not mean that they are doing the wrong thing by not prescribing the antibiotic at this very moment. All of this to say, please be responsible with antibiotic use, with antibiotic prescriptions, and with asking for your provider for antibiotics for symptoms and illnesses that don't require them. Because now we're seeing these superbugs, and even infants are getting them who have no history of taking antibiotics in the past, simply because we are seeing such an abundance of these strains of bacteria in the community. Stay well, everyone.